sitting down at my kitchen table and saying, okay, what do I believe about health? And of course, the first thing that came up was the belief that disease is a meaningful aspect of health, because I had been through that with my mother, and I knew that simply having a disease doesn't make you unhealthy.
Okay, well, according to Newman, the theory of health as expanding consciousness includes the health of all persons in the presence or absence of disease.
And she states that health is viewed as a process that encompasses both disease and non-disease.
She also states that health is the expansion of consciousness.
So what does that mean?
Well, to me, that means that you're healthy whether or not you have disease, that your disease is always present. And it's a matter of when it manifests itself, that you're always healthy whether or not you have it.
Well, I think it means that you can be unhealthy, but you can get to a healthy place, even though you have that particular disease.
Right.
You know, maybe you need to, she talks about disease as a reorganization of processes.
Right.
And maybe that disease caused you to grow in your consciousness of what you thought disease was, or how to interact with that disease, or with somebody else with a disease.
Right.
And I think it's kind of when you find that you have a disease, like the symptoms or something, your life is really shaped by that, and your consciousness is expanded. You can't really do the things that you used to do, or you have to adapt or change.
Right.
And so that's kind of changing your mind, changing your consciousness about how you're going to live your life now, and hopefully you can either grow from it, or you can succumb to the disease.
Yes. Okay, Newman states that consciousness is expressed in patterns of rhythmic movement toward higher levels that can be described in time and space.
She also says that if disease is the only way that a patient's pattern can manifest itself, then that is health for that patient.
They also say that removal of the pathology in itself will not change the pattern of the individual person.
So what does that mean?
I think it means that she talks about patterns of exchanging, communicating, and relating. And I know that firsthand because I went through so many doctors after my accident that wouldn't listen to me, wouldn't exchange ideas. And then I finally found a doctor that was willing to listen, exchange ideas, and he found patterns to help me through what had happened to me in the accident.
And I think that it really affected his pattern too. Like he's learning about you, and at the same time he's growing and he's expanding his consciousness, and he's identifying your unique pattern that all the other doctors refused to even acknowledge, or they couldn't figure it out.
Right.
So what helped was him reflecting back what you said, so that it made you become more aware of your circumstances that were, being overlooked by the other doctors.
Definitely.
So it kind of helped you to understand your own pattern too, and now you have grown from that, and you're better able to, you have better health probably now.
I have much better health because I think that once he listened to me and stopped relying just on blood tests and whatever, he realized that there was a unique situation in what had happened to me, my pituitary gland being damaged, and that he couldn't rely on just the blood tests. He had to listen to what I was saying as well. So we both learned, I think, from that experience. I learned, I got better. He learned, I think, from dealing with a unique situation.
So you guys both grew and were able to expand your consciousness.
I believe so.
I'm defining consciousness in a way very similar to the way Benthoff defined it. He defined it as the quantity and quality of interaction with the environment. And I think I've added to that the informational capacity of the system.
So how is consciousness expanded?
Well, if health is viewed as a process that encompasses both disease and non-disease,
Then instead of viewing health as good and disease as bad,
Newman suggests that disease is a possible facilitator of health.
so consciousness is the capacity of the whole, and it's revealed by the evolving pattern.
Okay, and then if consciousness is the quantity and quality of interaction with the environment,
Well, that's how a disease manifests in an individual depends on the pattern of that patient. So, the disease exists before the symptoms appear, and the removal of the symptoms of the disease will not change the individual's pattern.
So health is expanding consciousness theory then is what?
Reflecting on the pattern of the person within the larger pattern of the environment.
Oh, that makes sense.
It does.
Yeah.
Many nurses believe that Margaret Newman's theory of health as expanding consciousness can only be implemented when the nurse has more time to interact with the patient. This is not true. This theory can be used with every interaction a nurse has with a patient. In the following scenario, a patient is brought in by ambulance to the emergency department for treatment of severe dehydration related to nausea and vomiting secondary to her AIDS infection. The nurse must enter the room with being present in a way that the patient feels respected and regarded as a whole person.
Hi, Miss Jones. My name's Carrie. I'm going to be your nurse today. So I see you've been having some vomiting and nausea today?
Yes,
How long has that been going on for?
about a few days.
A few days? Okay. What we're going to need to do is put an IV in your arm because we need to put fluids into you because you're dehydrated. Is there any particular arm that you want me to put it in? Is that one? Okay, that'll work. So how's everything else been going on?
Well, I'm a single mom with 5 kids, and I'm really starting to worry about what's going to happen to my kids when I get sick and die. I'm not going to be able to take care of them the way that I always have. I don't really have anyone to support me, and the only person I can talk to is the kid's social worker. So it's really been weighing me down.
Gosh, that's sad. It sounds like you've been going along pretty smoothly for you and your children up until this point. And the care of your children has been really important to you.
Yeah.
Okay. But you do feel isolated now?
Yeah.
Feel isolated? Especially, once you're reflecting on knowing that you're going to have a difficult time later on. Okay.
Thank you.
You're welcome. Let's work on this together. Maybe we can find some solutions for you. Okay?
Okay, thank you so much.
We'll find people to maybe support you that are close around you. Okay? And then I have some extra resources that we can do to help you. Okay?
As we have just seen, nurses are capable of implementing Margaret Newman's theory. By the nurse attending to the whole of the patient's experiences and the possibility of transformation, one can reflect not just on the physical body, but on the spiritual growth for the patient and her family. If the nurse just focused on the physical deterioration, health would not have taken on a new meaning. Nursing is caring in the human health experience. Nursing is seen as a partnership between the nurse and the client, with both growing in a sense of higher levels of consciousness.
What I hear from nurses when they call me is that it's not a theory that they go out to test or they go out to apply. This is an explication of what they have been doing.